Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. Today I want to talk to you about phalloplasty and especially phalloplasty in consideration to your sexuality. And what do I mean by that? Well, I do quite a bit of evaluations for gender affirming procedures, and a lot of the trans guys or trans men or trans masculine individuals that I do see tend to go for phalloplasty, which is totally fine. When I ask during evaluations why they prefer to go for phalloplasty over metodioplasty, for example, usually the response is, I really want to make sure I have a penis, and I really make sure that I have a large penis, because metodioplasty will not give you the same size as a phalloplasty will. And that's a very valid personal reason to choose phalloplasty over metodioplasty. Now, when I hear the type of answer, usually the type of answer one way or another will be tied to social constructs in a sense of what we see a man to be and our social relationship to, man equals having a large penis. And so when I talk to the guys and then I ask them further about their sexuality, a few things tend to unfold that people sometimes tend not to take into consideration. I wanted to share some of the things with you. You really want to, prior to even considering phalloplasty, you really want to ask yourself, what is my sexuality? So who am I attracted to? Am I attracted to men or women or both? And then you want to ask yourself, what kind of sexual function are you seeking, and whether phalloplasty will give you the type of sexual function. So let me give you an example. So sometimes I'll evaluate somebody who identifies as a gay male, and when I ask them about their sexuality, they realize that their sexual position during intercourse is actually being a bottom, and that in fact having a large phallus is not something they're not interested in, but that's something they're seeking because that represents, a masculinity in our society today. And sometimes when they think about it, they realize that maybe those are not the best reasons to seek phalloplasty for. Because don't forget, out of all the gender affirming procedures for both trans men and trans women, phalloplasty is still to this day the most complicated and difficult procedure to do. And that's a procedure that carries the most amount of, not the consequences, but complications. So I really want you to think about it, because unless you're also going to see a specialist for phalloplasty, it can become a very difficult procedure, and those complications can be very dire. So another thing to consider during sexuality is, if you're attracted to women, are you interested in having penetrative sex? Or if you're attracted to both sexes or attracted to men, how much penetration on your end is important to you? Because the truth is, sometimes we think, we want to be sexually functional, and sometimes we think that we really want to have penetrative sex, and we realize that that's really not a priority for us. So you really want to be mindful. You want to take consideration of your sexuality. You want to be in consideration of what kind of sexual function you'll be seeking, and if phalloplasty can give you that. Now, by no means, I'm not trying to discourage you from getting phalloplasty. I think it's a very important gender-affirming procedure to affirm and make the body feel much more congruent. But giving all of the high complications with phalloplasty, I just want you to do a little bit more thought process behind it. Sometimes I ask the guys, what matters more for you, to have penis, but what happens if that penis is not sexually functional? What if you have complications and you can't use it? So you have the phallus, but you really can't use it. So take that into consideration when you do think about bottom surgery. Thinking about your sexuality and what's really important to you is a big deal, and ask yourself all of those things before you jump into it, because it is a very complicated procedure. I have personally seen people that have had severe complications as a result of this procedure. And again, if you are that set on phalloplasty, that's just fine. I respect your personal choice. Make sure then you do see a specialist, somebody who actually really specializes in trans care, and a surgeon who has performed a number of the phalloplasties. Don't just go for somebody that your insurance gives you, or a doctor in your local region that you haven't heard anything about. So make sure you do that. And if you need more info, I have doctors who are specialists in phalloplasty on my resource page on my website, so you have access to that to check that out. If you're watching this, comment below. Let me know, have you had phalloplasty? If you had it, how did it work out for you? Did you consider your sexual function or sexuality prior to phalloplasty? If you haven't had phalloplasty and you're thinking about it, Is sexuality something you actually think about, or is it just all about a matter of having a phallus and not really so much about the sensitivity and being able to be sexually functioned that really matters to you? What matters to you most? How do you outweigh those factors? Comment below. I'd love to hear from you, and I'll see you guys all next time. Bye.